This is Health 54 right here on your digital first Pan-African News Network, TOS Television. I am Rose Audu. In a bid to commemorate the 2021 World Pneumonia Day, which is marked November 12th of every year, and World Diabetes Day, also marked on November 14, TOS Television Network engaged the health expert Dr. Roland Aigbovo, former President, Association of Resident Doctors FCT chapter, who spoke extensively on the significance of the days, the possible causes of pneumonia, diabetes, and the preventive measures to be taken in order to maintain a healthy lifestyle. Statistics showed that about 800,000 children below the age of 5 years die due to pneumonia annually. Adults over the age of 65 years are also more at risk of contracting the disease. The disease can be caused due to a variety of reasons such as asthma, heart disease, smoking, frequent hospitalizations, using a ventilator, weakened immune system, and so on. People who are recovering from surgical procedures which required anesthesia or have medical issues affecting their gag reflex are also at risk of pneumonia. Dr. Roland has more to say.
World Health Organization is a body that is responsible for policy formulation and all of that. So there are different days set aside for different medical conditions. And what basically means is that on that particular day, we could come up with new ideas, or there are new innovations on how to tackle that particular disease. And pneumonia is actually the inflammation of the alveoli, which is the sac that actually helps in respiration for gaseous exchange. And when there is inflammation, it impedes gas exchange in the body, and thereby leading to compromise of the what we call perfusion, ventilation, which is use of oxygen exchange in the body. There are several causes of pneumonia. One, it could be bacteria, which is called, there's what we call the streptococcal pneumonia. There's what we call the other one, hemophilia influenza virus type B. And they also have viral infection, viral causes like respiratory syncytial virus. And for those who are immunocompromised or have immune suppression diseases, especially those living with HIV/AIDS, there's this other called pneumocystis jirovecii. Those are the ones that causes the microorganisms that causes pneumonia. And there are also environmental factors like air pollution, and that whether at home or outside the house. Diabetes is basically a lifestyle problem, or if you use a non-communicable disease. What does it mean? You cannot transmit diabetes by either sweat or blood and all of those stuff. One, there's a family history. If either your parents or siblings have diabetes, someone is prone to having diabetes. If somebody is living a sedentary lifestyle, like always sitting, no exercise and all of that, somebody can have diabetes. There are some drugs that you take that can prone you to having diabetes. And diabetes is also of two types. You have type 1 and type 2. The type 1 is the insulin dependent, and the type 2 is the non-insulin dependent. And it affects, now we are having a lot of statistics affecting children of younger age. Because before now it has been a particular age group, maybe from 10. So we've seen over the years that it's now even children, even less than 10, are coming down with diabetes.
And the theme for World Diabetes Day 2021 to 2023 is access to diabetes care. According to World Health Organization, the number of people with diabetes in Africa is growing rapidly, and death rates from COVID-19 infections are much higher in patients with diabetes. It was reported that there is a 10.2% case fatality rate in COVID-19 patients with diabetes, compared with 2.5% for COVID-19 patients overall. A WHO analysis of data from 13 African countries found as of Thursday, Africa has recorded over 8.6 million confirmed COVID-19 cases and 220,000 deaths. According to the WHO, an estimated 70% of people with diabetes on the continent were unaware they had the disease. Millions of people with diabetes around the world do not have access to diabetes care. People with diabetes require ongoing care and support to manage their condition and avoid complications. Guinness World Record has established that an Alabama-born baby Curtis, who was born at 21 weeks, has set the new record as the most premature baby in the world. A full-term pregnancy is usually 40 weeks, making Curtis nearly 19 weeks premature. His mother, Michelle Butler, went into labor on 4th July 2020 as Independence Day fireworks filled the night sky and gave birth to twins, Curtis and Sia, at lunchtime the next day. Unfortunately, Sia died a day later. The hospital said it typically offers parents compassionate care in such situations allowing them to hold their tiny infants for what little time they may have left together. And despite the fact that cholera is simple to treat, experts have maintained that over 90,000 Nigerians have been affected with the disease. Cholera outbreak has been reported in different parts of Nigeria, with over 3,000 related deaths in 2021. The alarming number of infections and deaths have been attributed to substandard healthcare system and poor hygienic practices observed by affected persons and communities. Despite the alarming rate of reported infections, over 900 primary health centers have been closed, creating intense difficulty for infected persons to get adequate treatment, according to a report. Out of these primary health centers, 837 of them have been temporarily shut, of which 220 centers are in war-torn Borno State, while 81 of these centers are permanently closed. Other states which have permanently or temporarily shut health centers include Adamawa, Katsina, Kebbi, Kwara, Nasarawa, Taraba, Yobe, Kaduna, Ekiti, Niger, Ogun, Osun, and Oyo states. According to experts, pregnant women and unborn children and newborn babies are among vulnerable groups with high risk of exposure to infection, hence the importance of prevention of mother-to-child transmission of HIV services. Medical experts who are disturbed over the situation have called on the three tiers of government to commit adequate funds as well as demonstrate political will to make the PMTCT program in the country a success. While lamenting the lack of progress in this sphere, a consultant pediatric hematology oncologist, Professor Adamison Temiye, said the major issue is that governments at all levels are not putting in enough efforts to solve the problems. Although new HIV infection rates and acquired immunodeficiency syndrome AIDS-related deaths have been on a steady decline over the past decade, the Western Central African region accounted for 22% of AIDS-related deaths in 2020. Around 200,000 people in the region became newly infected with HIV last year, out of a global total of 1.5 million, UNAIDS data shows. And this is TOS Television Network, and you're watching Health 54. Do stay tuned. Welcome back. The World Health Organization has said tuberculosis remains one of the leading causes of death worldwide, as it is not just the struggle to end tuberculosis as a disease, but also the struggle to end poverty, inequality, unsafe housing, discrimination, and stigma, and to extend social protection and universal health coverage. WHO Global TB Report 2021 says an estimated 9.9 million people developed TB in 2020, with Nigeria having the highest burden in Africa and accounting for 4.6% of the global TB burden. Speaking at the National TB Conference 2021, the WHO representative to Nigeria, Dr. Walter Malumbo, said the emergence of COVID-19 pandemic slowed down the progress made towards ending TB epidemic, and there was a large global drop in number of people newly diagnosed with TB, from 7.1 million in 2019 to 5.8 million people in 2020. Data from phase 3 trials have shown that Covaxin, the first COVID-19 vaccine developed in India, offers 78% protection against the virus. This is according to findings published in Lancet. Covaxin gained emergency approval from the World Health Organization last week, the 8th jab to be given the green light by the health body. The vaccine has already been cleared for use in 17 countries. And a dog has tested positive for COVID-19, making it the first documented case of its kind in the United Kingdom. They believe the pet, who is recovering at home, caught it from its owner. The UK Health Security Agency says cases like this are extremely rare, and there is no strong evidence to suggest that dogs, cats, or other pets are passing on the virus to humans. It is against this backdrop that experts are asking owners and people who work with animals to wash their hands regularly to maintain good hygiene. Animal fur can act as a carrier for the COVID-19 virus for short periods of time, in the same way as other surfaces such as door handles, says experts. The National Drug Law Enforcement Agency, Edo State Command, said it apprehends 20 suspected illicit drug traffickers in the state. The state commander of the agency, Buba Wakawa, made this known during an interview with newsmen on Thursday in Benin. He stated that the suspects who were arrested in October included 18 males and 2 females. He also said that 2,390.854 kilograms of hard drugs made up of cannabis sativa and psychotropic substances are recovered. And WHO responding to a request from the Sierra Leonean authorities for urgent support following the fire accident that claimed the lives of over 101 people on Friday, delivered 6.6 metric tons of emergency medical supplies to support the government and people. TOS Television had reported that the tragic fire incident occurred when a truck hit a loaded fuel tanker in a road traffic accident late on November 5, leading to a fuel leakage that burst into flames in a crowded area. According to Dr. Stephen Shongor, WHO representatives in Sierra Leone, the response so far has been swift, as the national authorities and partners were able to quickly mobilize available local stockpiles to start care for the people affected. And that is Health 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS Television Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS Television Network. Remember, health is wealth. So till I come your way again, do stay healthy. I am Rose Audu, and many thanks for watching.